Hello everyone and welcome to today's Connect and Learn webinar. I'd like to begin by acknowledging the traditional owners of the land on which we meet today and pay my respects to their elders past, present and emerging. I extend that respect to Aboriginal and Torres Strait Islander peoples listening today or in the future. We recognise and value the knowledge and wisdom of people with a lived experience of addiction, their families and supporters. We celebrate their strengths and resilience in facing the challenges associated with their recovery and value their important role in the development and delivery of health and community services. My name is Rebecca and I will be facilitating today's webinar on recent trends in alcohol and other drug use and harm in sentinel populations of people who use drugs in Victoria, presented by Dr. Caitlin Douglas and Professor Paul Dietze. This webinar is part of a series of Connect and Learn webinars designed to support AOD clinicians throughout Victoria. This webinar series is funded by the Victorian Department of Health and hosted by Turning Point. We do want our webinars to be interactive where possible, so please ask questions via the Q&A function, not the chat function. The questions will be collated and answered by our presenters at the end. Please be aware that our webinars are recorded and are made available later on our Turning Point website. Our presenters today have kindly agreed to share their slides via PDF, which we will forward to people at a later date. We encourage you to stay to the end of the webinar and complete the exit survey when the QR code appears on the final slide, or also send it via email. Like I said, the slides will be emailed to you. I'd like to introduce our presenters, Professor Paul Dietze and Dr. Caitlin Douglas. Paul is one of Australia's leading alcohol and other drug epidemiologists, and Caitlin is a senior research officer at the Burnett Institute. Thank you both for joining us today. I'll hand it over to you, Caitlin.
Okay, so thanks for the invitation to speak today. Paul and I are going to present some data on alcohol and other drug use among young people and people who use drugs in Victoria. And I'd just like to begin by acknowledging the traditional owners of the land in which I live and work, the Boon Wurrung people of the Kulin Nation, and pay my respects to elders past and present. So for those of you who may not have heard of us before, the Burnett Institute is a not-for-profit medical research organisation in Melbourne. We also have offices in Myanmar and Papua New Guinea. A lot of the work that we do focuses on disease elimination, particularly for hepatitis C. And we also do public health research with an aim to translate our findings into practice. We have a fabulous fieldwork team, so we've got a picture of Peter Higgs on the slide there. And they all work really hard to collect all of the data that we'll be sharing today. So we thought it would be a good opportunity to give you a bit of a smorgasbord of the research that Burnett Institute is part of. And so I'll begin by telling you a bit about Vanessa, a study that we conduct with young people at music festivals. And then I'll hand over to Paul to speak about the Victorian Methamphetamine Cohort Study, known as VMAX, and the Illicit Drug Reporting System, known as IDRS. So the Vanessa study is a partnership between the Transport Accident Commission, Graffiti and Burnett, and we've been working together a number of years to conduct a survey with young people at music festivals. And so this work came about because Megan Lim and other researchers at the Burnett had been running a survey at the Big Day Out. This ran from 2005 to 2014. Sadly, by the time that I'd started at Burnett, the Big Day Out had been cancelled, and so the survey moved online. But we know from that existing work that festivals and events are an important place where young people can come together to celebrate and experience freedom. And we also know that alcohol consumption and other drug use is higher among people who attend festivals when compared to the general population. We've also learned that it is possible to reach and recruit young people for research within these settings. And so it's a really great opportunity to learn about their behaviours and to inform some of the services that are delivered within these settings. So the Vanessa service is run by the Transport Accident Commission with Graffiti Group, and their primary aim is to support young people to make safer road choices. And so the team take the Vanessa bus, shown on the slide there, as well as a fleet of other vehicles to different festivals and events in both Metro Melbourne and regional areas of Victoria. They also attend events run by unis and TAFEs. So they go to things like orientation weeks, and they are there to kind of discuss road safety issues. They offer free breath testing for people, and they also engage with young people through competitions, chill out spaces, and fun activities. And so we've partnered with the Vanessa service since 2018 to run a survey at the festivals and events that they attend to find out who is actually using the service and what do people get up to when they're attending these festivals and events. So we've previously published some of the results from this study from 2018, and we've done some presentations from our work in 2020. However, because of COVID causing major disruptions to festivals and events in Victoria, we had a bit of a break in our data collection, and 2023 was the kind of first year that we were back in action. And so today I'm just going to share some of the results from that most recent survey that we did. So the way that the study works is that we train Vanessa staff to conduct the survey, and then the Vanessa team attend festivals and events, and they recruit the participants. The data collection last year was between January and April 2023, and participants self-complete the survey on a tablet through RedCap, a program that we use. Because the internet is pretty patchy at some of these festivals and events, the data is initially collected using an offline version of RedCap. And then once Vanessa team are back at headquarters and have an internet connection, the data are uploaded to a secure server. Participants are eligible to take part in the survey if they are aged 16 years and over, and not displaying any obvious signs of intoxication, so that they can provide informed consent. We aim to keep the survey quite brief, so that it's not a major interruption to people's festival experience and also with their interaction with the Vanessa service. We ask questions about demographics, how people get to and from festivals and events, alcohol consumption, drug use, and also drink and drug driving beliefs. Participants can also provide their contact information on a separate tablet and go in the draw to win an iPad. And so in our latest survey in 2023, the Vanessa team recruited 650 participants from 11 festivals and events throughout Victoria. Most participants were from uni and TAFE settings. We had 215 from Metro Melbourne festivals and events, and then 145 from regional festivals and events. The median age of participants was 22 years, most identified as female, and we also had 31% who identified as male and 5% as non-binary. So we asked participants, how far did you travel to the festival or event that they were attending? And we found that most people were traveling less than 20 kilometres to get to the festival or event. Not surprisingly, regional event attendees were traveling the furthest, so 65% went over 100K. And then among uni and TAFE event attendees, they were traveling the shortest distance, with around half reporting they went less than 20 kilometres. We then asked participants how they planned to get home, and we found that among people recruited from uni and TAFE events, most were planning to drive, with the second most common option being public transport. Among people from metro festivals and events, public transport was the most common mode of transport, and 42% were planning to drive home. When we looked at regional festivals and events, the overwhelming majority of people were planning to drive home, and a smaller number were planning to get public transport, and also take festival transport home as well. So things like buses that are arranged through the festivals. So among people who were driving home, we also asked them some follow-up questions around were they planning to drive themselves or get a lift from someone else? And when we looked at the different event types, we found that most participants from uni and TAFE events were driving themselves. Whereas when we looked at metro and regional participants, we found that people were more commonly planning to share the driving with friends, followed by driving themselves home. And then we had a smaller proportion of participants who were planning to get a lift from parents or get a lift from a sibling. Next, we looked at the number of drinks that participants had consumed in the past 24 hours. And when we looked at university and TAFE participants, we found that the overwhelming majority had not consumed any drinks in the past 24 hours. And in contrast, we found that around a third of metropolitan participants had consumed no drinks in the past 24 hours, and 21% had consumed 5 or more drinks. And then when we looked at regional festival attendees, we found that 27% had consumed no drinks in the past 24 hours, and 28% reported consuming 5 or more drinks. We also asked participants the questions that make up the audit C score, and we classify their score as low, medium, or high risk of experiencing harm. And so when we looked at the different event types, we found that 57% of uni and TAFE attendees reported low risk drinking, 57%. A third of metro attendees reported low risk drinking, and 30% from regional events reported low risk drinking. If we look at the other end of the scale, we found that 14% of both metro and regional participants reported high risk drinking compared to 7% of uni and TAFE attendees. We then used multinomial logistic regression to look at what factors were associated with reporting a medium risk audit C score compared to a low risk audit C score. And so we found that participants who were born outside of Australia and those who were currently studying were less likely to have a medium risk audit C score compared to a low risk one. We then looked at who was more likely to report a high risk audit C score than a low risk audit C score. And we found that participants who identified as male were more likely to have high risk audit C score. And our results also showed that people who were born outside Australia, those who were currently studying, and people who were planning to drive home were less likely to have a high-risk audit C score. We also asked participants how many drinks they thought it would be okay to have before driving. And we found that most participants selected no drinks. They didn't think you should have any drinks before driving. And 35% reported 1 or 2, with quite a low percentage reporting any more than that. We also asked participants, have you or do you plan to use drugs besides alcohol at the festival or event that they attended? And we found that a minority of participants overall, 13%, reported they had used or planned to use drugs besides alcohol at the festival or event they attended. This was higher among participants from regional festivals at 28% and metropolitan festivals at 17% compared to uni and TAFE events at 3%. Among participants who did report they had used or planned to use drugs at the festivals or events they were attending, they most commonly planned to use ecstasy, acid, ketamine, cannabis, or cocaine. We also ran a logistic regression to look at who was more likely to use or plan to use drugs at festivals and events. And we found that participants who had previously reported ever using drugs were much more likely to report planning or using drugs at the festival or event. And we also found that participants who identified as female had lower odds of reporting using or planning to use drugs at the festivals or events they attended. And finally, we also ask people what is the minimum amount of time that people should wait after using drugs before driving. And here we've split up results by people who had used drugs in the orange and people who'd never used drugs in the green. And so we can see that among participants who had never used drugs before, most reported that they didn't know how long you should wait before driving after using drugs. And then in the orange, we can see that most participants who had used drugs before, around a quarter reported that they should wait more than 24 hours before driving. So from these results, we can see that young people are travelling long distances by car to attend regional festivals and events. We've found that alcohol and other drug use is typically higher at metro and regional festivals and events when we compare it to the uni and TAFE settings. Similar to other data sources, we've found that males report higher risk behaviours than female participants. And when we look at those drink and drug driving belief questions, we find that most participants are endorsing kind of safer drink and drug driving beliefs. So the results we've shared from this survey should be interpreted with some caution because it is a convenient sample. We are recruiting people when they've approached Vanessa, so they've kind of gone up to a service in the context of a festival. So they're likely to be different from those people who potentially aren't using services like this. And RedCap is great. Sometimes it's a bit stressful when you're trying to upload the data. So we've just got to make sure that we're checking in with the staff to get all of the data uploaded to our server. But our strengths are that the survey is a great tool to be able to identify young people's behaviours. It's quite brief, so it's not a big interruption to their festival experience and their interaction with Vanessa. And because we're working closely with the TAC and with Vanessa, we're able to share back results with their staff so that we can inform the kind of messages that they put together and the kind of services that they offer to festival attendees. And so in conclusion, interventions developed with young people who plan to consume alcohol or use other drugs at festivals and events are really needed to minimise the harms and meet the needs of this population. So thank you. I'll now hand over to Paul to talk about our other studies and happy to take questions at the end using the Q&A function. Thanks.
Thanks, Caitlin. I'll come off mute. I'm going to be talking about two key studies from the Burnett's kind of alcohol and other drug group. We run a mix of different types of study designs. So we have, basically a series of prospective cohort studies, one of which is the Victorian Methamphetamine Cohort Study, which I'll talk about in a minute. And that's basically where we recruit people at baseline and then we follow them up for a period of time, looking to see what sort of trajectories they experience in terms of their drug use. And they've been running at Burnett for a very long time. So Burnett started one called the Victorian Injecting Drug User Cohort Study back in the 1990s, for example. And then we also run the cross-sectional studies, such as the one that Caitlin's just walked you through, Vanessa. We also have a series of other cross-sectional studies, and I'll talk about one of them, the Illicit Drug Reporting System, a bit later. So basically, as I was saying, we're really trying to look at these trajectories of drug use, and methamphetamine use is obviously a behaviour of considerable concern in the community, and we're really trying to determine the nature and extent of it, and importantly, that natural course. So lots of people might sort of use methamphetamine for a very short period of time. They might experience very few problems. Alternatively, lots of other people might move into periods of dependence and so on. And these sorts of things are driven by a range of factors, including the way the drug acts in and of itself, but also social factors that come into it, as well as sort of health experiences that people might have. We're ultimately looking at ways of trying to improve our interventions. And importantly, this is the first study of its type to be run in rural Victoria, actually rural Australia. So there's really not much information, certainly not long-term information available on methamphetamine use in rural Australia, despite there being, sort of major concerns raised in many rural parts of the country. So basically, people had to be over 18, they had to be smoking. We were trying to focus on smoking methamphetamine rather than injecting. There's been many studies of methamphetamine that have involved mostly injecting rather than smoking, but we know that smoking is sort of the number one route of administration now in Australia. People had to basically want to participate in this longitudinal study and need to be able to provide informed consent, which, is not necessarily all that easy for a lot of these people. We recruited people through respondent-driven sampling as much as possible, so that gives us a mechanism of at least saying what the network of people who they might be using methamphetamine with looks like. And so there's a network diagram there. I won't actually explain what that is, but it just highlights that there are usually links between populations of people who use drugs. And you can try and use those links to actually understand the nature of the population. People are reimbursed, and we also have ongoing recruitment, and we're actually expanding the methamphetamine cohort over the next 12 months since we got some additional funding from the NHMRC. So this is what the sample looks like. So mostly male. An average age of about 34. Around about 13% identify as Aboriginal or Torres Strait Islander, which is quite high. High levels of homelessness, relatively low levels of education. So most people, have not been educated beyond year 11, and high levels of unemployment, and reasonably low income reported by the group. You can see in terms of we've classified the regional areas in terms of whether or not people are from a regional centre, a large rural town, or a medium small rural town. We're trying to avoid not actually naming the towns that we recruited in. And that's specifically to avoid sort of stigmatising those towns. But we do have variation there. You can see that we do have relatively large, rural town, and sorry, we have representation from small rural towns as well. And this is using what's called the modified Monash model for classifying different areas. And you can see that there are some variations between the different cities that we were recruiting from. So in Melbourne, only 3% of the sample identified as Aboriginal or Torres Strait Islander, but much higher rates outside of Melbourne. Similarly, the homelessness figures are much higher in the rural component of the sample, and so on. And then in terms of patterns of methamphetamine use, we also saw some differences there. So more powder methamphetamine being consumed in metropolitan Melbourne. And this was, I should have pointed out, sorry, that this is the baseline figures. So we recruited around about 750 to begin with. The sample's actually a little bit larger than that now, as we've sort of recruited people to replace them because we might have lost people to follow up and so on. But you can see in metropolitan Melbourne, around about 47% report using powder methamphetamine rather than crystal methamphetamine, but basically everybody does report using crystal methamphetamine. And that's not surprising, given that crystal methamphetamine really now dominates the methamphetamine market. And around about 15 years of meth use for people who are in the cohort. As I said, we were really trying to recruit people who smoke the drug. There are some who did report injecting, most reporting reasonably frequent use. a fair amount of methamphetamine dependence in the cohort, again higher in the rural sample compared to metropolitan Melbourne, and a large, or just over half of the sample reporting accessing professional support for their meth use, and that didn't vary across the different areas we were sampling from. So basically, there's at baseline, there's quite a few sorts of things that characterise people. So people were more likely to report being dependent if they reported using crystal methamphetamine, or if they report more frequent use, which doesn't surprise. We also have published a paper just on parents within the cohort. So a lot of the people in the cohort actually reported reported being parents. 41% were mothers and 59% fathers. Typically, those who lived outside of the major city or identified as Indigenous and so on were more likely to be parents. And, this has important implications for how services have been managing these people. And then we have lots of evidence in here about sort of intergenerational removal as children and so on, which, is quite... it's very important in terms of trying to work out where to intervene to try and protect families and protect children from essentially going through and cycling into sort of similar sorts of situations as their parents. So here's the co-residency status, and you can see that 75% of all children are living elsewhere, which is not necessarily a good thing for the child, not necessarily a good thing for the adult. More children were living with the women in the study. So in terms of social support, so, people who reported being homeless, moderate to severe depression or older, or more frequently using methamphetamine, indicated that they had lower levels of social support. Not surprisingly, if you're in employment, you had higher levels of social support being associated there, and females reported high levels of social support. Mental health. So basically, these figures highlight the high prevalence of anxiety or depression, or both anxiety and depression. You can see that around about well over 50% of the sample are reporting that they have experienced anxiety or depression. Lots of them have reported going to mental health professionals. But there are gaps there, so there's quite a few people there who aren't reporting going into see a mental health professional for mental health reasons, which is something that we'd be thinking again in terms of intervention points. Accessing specialist treatment. So a lot of people reported that they had accessed specialist treatment. So that's things like residential rehabilitation and counselling and so on that are provided across state government agencies and so on. These are the predictors of of accessing specialist treatment, So people who are employed, people who didn't identify as Indigenous, reported accessing specialist treatment more than those who did not. Imprisonment, recent arrest, being dependent or injecting also were associated with accessing specialist treatment. One of the big things that people talk about, particularly overseas, in relation to methamphetamine use are things like meth mouth is a common thing that's spoken of in the context of methamphetamine use. And you can see that, basically we identified that quite a few people in the cohort did experience poorer oral health related quality of life. So these are two measures of oral health related quality of life, not just oral health more broadly. So prevalence means that 35% reported fairly often experiencing poor oral health related quality of life, and moderate to severe depression was associated with that. and extent. So it's 3 times higher the poor oral health related quality of life than the general population. Most high in rural Victoria. Again, moderate to severe depression was closely predictive of this. And what was most interesting, though, for us in this paper was that there was no significant association with route of administration. So there is a suggestion that smoking methamphetamine would actually be worse in terms of oral health related quality of life and oral health outcomes compared to injecting. And we actually found that there was no association there. And then drug driving. So drug driving is a sort of contentious but important issue. So we've seen overall in Victoria that the presence of methamphetamine has been detected in road fatalities at an increasingly frequent rate over the past 15 years or so. And so, methamphetamine-related drug driving is considered to be a major public health issue. But importantly, in this cohort anyway, most of the people who did report drug driving, so that's driving within, I think in this study, 3 hours of consuming a drug. Around about half believe that they're not at all impaired, and another 32% believe that they're only slightly impaired. They kind of indicated a lack of concern, but they did indicate that they were concerned about being caught by police, and that's potentially, sort of feeding into the idea of whether or not roadside drug testing actually has a deterrent effect here. History of incarceration. So 30% of the sample report adult incarceration, which is actually lower than our comparable studies of people who inject drugs, but still very concerning. 11% of the sample reported having been in juvenile justice, and of those, 78% then went on to an adult incarceration. So basically the cohort have lots of indicators of marginalisation and not travelling so well. One of the studies we've used, one of the longitudinal questions that we've used these data to look at has been to look at the impact of COVID on the price and use of methamphetamine in the cohort. So you can see here that basically prices being paid cohort for methamphetamine and methamphetamine use frequency are really pretty stable from the initial recruitment in 2016 through to when COVID hit Victoria. And you can see, though, that once the sort of lockdown began, you can see there was a pretty big increase in methamphetamine prices that was felt more acutely in regional Victoria rather than in metropolitan Melbourne, and that methamphetamine use frequency in the cohort also declined. And you can see it went through, considerable decline back through into May 2021. But it highlights the importance of having these sort of ongoing studies for us to be able to chart these impacts. There's no other study in the world that's sort of published on these sorts of figures. And this has been published in Addiction and was one of the. It really does highlight the importance of drug supply to things like patterns of use and so on, because you can see as prices went up, use started to go down. So now I want to talk briefly about the illicit drug reporting system. As I mentioned, VMAX, which I've spoken about, is a prospective cohort study, and we've got a comparable prospective cohort study of people who inject drugs called Supermix. And but we do, as I said, run a series of cross-sectional surveys like Vanessa to capture kind of more sort of surveillance kind of information. So the illicit drug reporting system is actually a national study that's funded by the Commonwealth Department of Health and administered by the National Drug and Alcohol Research Centre. And the Burnett's been running the illicit drug reporting system since around about 2008. Prior to that, in Victoria, it was actually run at Turning Point. So we actually have impressive trend data on a lot of these sort of market and other parameters around drug use that comes from this particular study. And what the Illicit Drug Reporting System, or IDRS, involves a whole range of different sort of surveillance activities, but the one I'm going to be talking about here today is annual surveys that we do with people who inject drugs, and we recruit about 150 people here in Melbourne, and they recruit either 100 or 150 in other capital cities across the country. And basically you need to report injecting drugs with reasonable frequency to be able to be eligible for the study. We also collect a range of secondary data sources, including things like ambulance attendances that we get through Turning Point's National Ambulance Surveillance Unit, and so on. And so we compile all of these sources of data and try and triangulate to look and see what sorts of things are sort of coming through consistently across all sorts of different data sources. Or alternatively, if there is a distinction between what's being observed and what's in one data source compared to another, then that points to mechanisms and questions for further investigation. So people are reimbursed here again. We conduct these interviews in June 2023. In Melbourne, they go remarkably quickly, and it's partly because of our fantastic collaborators in the sites in which we recruit people. It's all face-to-face interviews. And these surveys shouldn't be seen as being representative of all people who use drugs in the general population. They serve a surveillance function, and so they're designed to sort of pick up signals that might be sort of coming through drug markets and so on. So we look at patterns of use, drug market factors, range of risks, and then sorts of harm reduction behaviours that people engage in. So for our 2023 sample, we recruited 150 odd people. Median age was 45. Most were male. Around a quarter identified as Aboriginal or Torres Strait Islander, and that proportion's been going up over time. Most were unemployed, receiving a government benefit. In Melbourne, most report their main drug of choice being heroin. That's not the case in the other capital cities across the country, where mostly now it is methamphetamine that's reported as the main drug of choice. And you can see most of the people who are responding here are are injecting with reasonable frequency. So, around about 70–80% reporting at least weekly or more frequent use. So this is what the past 6-month heroin use data look like since 2000. You can see that, as I said, in Melbourne, the use rate is higher than the rest of the country. So, 87% report recent use of heroin in Melbourne, compared to 56% nationally. And importantly, relatively frequent use. So 72 days out of 180 is getting close to, every second day or so. And that's been consistent for a number of years. Some key trends here. So people reporting it was very easy or easy to obtain is getting overnight, is up to around about 100%. And prices have been increasing nationally, but staying relatively stable. In Victoria at around about $50 per point, or around $350 per gram. Interestingly, the perceived purity stuff I'll come back to, but only 30% of the sample are reporting that they perceive the purity of the heroin they're using at the moment as being high. And here's why I mentioned that that's interesting. So we also get the purity data for heroin seizures conducted by Victoria Police. So unlike other states and territories, Victoria Police tests all of their samples that are seized, and their seizures occur pretty frequently. So there's lots of drug operations ongoing all of the time. And you can see that the purity has increased pretty dramatically over the past five or so years. And we're getting up around about 55% pure for what is sort of normally cast as sort of a street level seizure. That is a seizure of less than 1 gram. Now that says to me that purity must be getting up to, in some instances, over 80%, which is basically getting us back towards the period of the heroin glut of the late 1990s. So 55% as an average purity is very pure indeed these days. In terms of methamphetamine use, again, methamphetamine use is a common thing within the sample and has been for a long time now. And you can see that it's mostly crystal methamphetamine since the early 2000s, and around about 77% of people are reporting that they're using crystal methamphetamine. At the same time, powder methamphetamines basically disappeared from the market. It used to be the sort of favoured form, at least here in Melbourne. But it's basically dropped down to almost zero. Base methamphetamine, a sort of waxy substance, has basically declined to zero as well. And here's what the trends look like in relation to prices paid and so on. And this is just for Victoria again in the figure. So unlike the heroin price, which you saw in the previous slide, in Melbourne, they seem to be paying about the same as what is reported nationally at about $50 per point. And again, people are reporting it as being very easy to obtain. Purity, again, is really interesting. So 22% only reporting high purity. And if we go to the next slide, you can see the average purity of methamphetamine seizures in Victoria is incredibly high, has been incredibly stable, and it seems to me that this very high purity is regarded by the consumers as being kind of average now. In fact, it's really not worth producing methamphetamine or consuming methamphetamine at higher than 80% purity, because anything higher really doesn't have any additional effect on people. One thing that's really coming out in Victoria that's really interesting is past 6 months GHB use. So most, like nationally anyway, GHB has never been a particularly frequently used drug, but you can see that it really has started to emerge in Victoria, around about 1/5 of the sample reporting recent use, and in 2023 it actually went up nationally as well. It's not very frequently used or anything like that, but it seems to be this is the cohort where people are experiencing GHB-related harms, and it might explain some of the trends we're seeing in, say, ambulance attendance data, where the ambulance attendances related to GHB use have been going up over time. And just anecdotally, our response, our field workers are telling us that there is an increase in GHB use reported in the field. So that's really all we really wanted to cover off. We've got so much data we could talk about it forever. As I mentioned, we've got the Supermix cohort, which I haven't talked about at all, but it's been running since 2008, and we have a really impressive array of data linkage there that can tell us a lot about what is happening for people. But we've just given you a brief sort of snapshot of the sorts of information that we collect, and lots of mechanisms that we use to feed this back into policy discussions and so on. But yeah, it's a pleasure to have had the opportunity to come and speak to you today. And if there's any questions, I see there's a few in the Q&A. So I'll throw over to maybe to Rebecca to coordinate that.
Thank you. Thanks, Paul. You may or may not be able to answer this, but what locations do you plan to visit next? Do you go to the eastern suburbs or the eastern region at all?
Yeah, I saw that question before. I wasn't quite sure whether or not I was referring to Vanessa in particular, or just our field work more broadly. So Vanessa basically just goes to wherever the the festival or the event is taking place. So there is certainly some Vanessa services provided to events in some of the eastern suburbs. So some of the O Week events, for example, were certainly run, so attended by Vanessa. And in terms of our fieldwork more broadly, we do go to across a number of different locations across Melbourne. So some of the southeastern suburbs are included in that. We did briefly go out to Box Hill and Ringwood at one point. We haven't been back out there for a while. We didn't have much success in relation to our recruitment, but we're certainly open to going back out there and taking our fieldwork presence out there.
Yeah, thank you, Paul. And yeah, the question did come through early on in relation to Vanessa. So thanks for that. Next question. What do you think is causing the discord between people's perceived low purity of heroin and methamphetamine and the actual relatively high purity?
Well, I guess people in these studies are generally, so in the illicit drug reporting system anyway, they're pretty dependent. So they're using quite frequently. And so as a consequence, their tolerance is probably going to be very high. So I suspect it's a function of the tolerance, but it highlights that you need to have a look at multiple data sources to try and interpret and create some kind of accurate picture. Because I don't think if we relied along with the consumer report alone, we'd be thinking that there's quite a lot of low purity heroin or methamphetamine out there, and that doesn't appear to be the case. But sort of being able to triangulate that with the police data means that we can then provide a sort of more nuanced picture.
Thank you. I appreciate that. What are the broader issues around drug checking in Victoria at the moment?
Well, I guess so. There's certainly been a lot of media coverage around drug checking, and like the Vanessa service goes into a space, and they actually offer breath alcohol testing as one of the things that they offer at the scene, and it sort of provides an insight into how people would behave if they were able to access something like drug checking at festivals. And I think there's some good lessons that could be learned if we were to go about trying to implement drug checking at festivals. But then I guess the broader question there, though, is, who should be able to access drug checking? So, the large majority of people who die from drug-related causes aren't kind of the festival goer crowd. They're really people who inject drugs or other people who experience marginalisation and so on. And it's that group who I also think really need to be able to access drug checking services, especially in the context of their potentially being, drugs like fentanyl potentially coming in the context of changes in the heroin market globally with the Afghan, the Taliban's heroin ban, for example. So, I think there's lots of issues to work through, but we should be not losing sight of that when we talk about drug checking in the community.
Thank you. Sorry, I guess this kind of follows on from the question before. Heroin purity is now really high again. What does that mean in relation to overdoses and overdose risk?
Well, certainly we've seen an increase in overdose fatalities in some areas. We've seen an increase in non-fatal overdoses as measured by ambulance attendances and so forth. In terms of overdose risk, the Supermix cohort's actually got data on this. We are able to look at mortality within the cohort and whether or not that's been changing over time. And what's sort of surprising is that the mortality risk amongst people who inject drugs in the cohort hasn't seemed to have changed much at all since inception. So it still runs at around about 1%. Around about half of that 1% per annum are overdoses. and that's still unacceptably high, by the way. That's, it's still definitely not acceptable, but doesn't seem to have increased. So that suggests that, there's potentially more people out there using heroin in this context of a sort of increased market. So maybe people have been switching from methamphetamine to heroin and so on. It is mostly people who inject drugs who are at risk of heroin-related death. And so, overdose risk doesn't seem to have increased much, but certainly overdose numbers have.
Thank you. Next question. Not sure if you can tell from your data, but is there any indication if the mental health issues emerge during the course of using the drug or if it precedes it?
So that's one of the fundamental questions that we set up these studies to look at. So we're getting towards the point where we'll be able to make sort of causal, or potentially some causal conclusions around that. I don't think we can actually say that yet, but yeah, we're moving there. So it's the chicken and the egg sort of thing. In relation to alcohol, there's been a long-standing query around that kind of thing, and they haven't been able to answer it with any certainty. What certainly seems to be is that there are joint sort of risks that can predict either heavy drug use or poor mental health, and that's probably a reasonable conclusion from the alcohol studies, and I imagine that we'll probably get somewhere similar.
Thank you so much. Methamphetamine use rates seem stable or declining in other data sources. Is the epidemic over?
Look, it's hard to know. I mean, we still hear reports of people, experiencing major harms, or there being, significant crimes committed while under the influence of methamphetamine. But certainly the number of people we see in treatment services is also sort of very high. So it's probably premature to say that it's over, but certainly the idea of there being this explosion in use in the general community is probably doesn't seem to be founded in the data that we have. But we still need to understand these trajectories. So we're seeing a lot of people maturing out of methamphetamine use in our cohorts. And they're doing that, around about half are reporting they're doing that with professional help, but the other half really aren't. And that's sort of consistent with this notion that, if some 2% of the population is using methamphetamine, not everybody is experiencing major harms. Most people will mature out of it and get on with their lives. So it's kind of, it is interesting to understand these patterns and try and put them in the broader perspective.
Thanks, Paul. Is there anything that either of you want to leave our attendees with?
Really, I just want to highlight just how much, research and information is available out there on alcohol and other drug use in the Victorian community. And then, we can really access a lot of it these days. We can make use of it for sort of advocating for change and, thinking about new interventions and how they can be evaluated and so forth is something that we're really always keen to assist with.
Wonderful. Caitlin, was there anything that you wanted to add?
No, I think that was really good. Yeah, we love collaborating and we love sharing our data. So if anyone has follow-up questions or is interested in partnering with us on anything, we're always open to things like that. So please reach out.
Thank you. I actually have got another one for you. Are you aware of similar research being conducted in Queensland?
So certainly the Illicit Drug Reporting System and its sister study, the Ecstasy and Related Drug Reporting System, are run in Queensland. They contribute to the national data there. It's mostly focused on Brisbane and the Gold Coast. And then there's the National Youth Substance Use Research group who also do a lot of work specifically in Queensland as well. There's no equivalent prospective cohort study like VMAX or our supermix cohort of people who inject drugs. They're uniquely or unique to Victoria.
Thank you. Thank you. We got maybe one last one. Sorry. What does the data say about the use of methamphetamine and GHB in the community of gay men?
So certainly there's lots of indications of high rates of methamphetamine use in the context of sex, but I'm honestly not sure about GHB in comparison. But there are various data sources that are being collected in relation to that, being run by sort of other organisations. And so I'd refer you to the Australian Research Centre on Sex, Health and Society, and also the Kirby Institute, who run sort of specific studies looking at drug use amongst gay and bisexual men.
Thank you so much. Thank you both for your time, and thank you for sharing your slides with everyone today. It's really helpful. Yeah, and just a reminder to everyone, if you can complete the survey, which was, you can access it via the QR code there, or we will send it out via email. But yeah, thanks everyone for attending. Thanks, Caitlin. Thanks, Paul.